Good morning, everyone. I'm Li Kangbing from Lincoln University College. Today, I'm very excited to present my research, AI-enhanced integrated English teaching for cultivating medical students' clinical communication competence. Let me begin with why I choose this topic. We all know that medical students need real clinical English skills, but if you look at traditional English teaching in most medical vocational college, what do students get? Mostly vocabulary memorization, grammar exercises, reading comprehensions, very little real practice and real interaction. Artificial intelligence has great potential to change this, but here is the problem. There are very few proven practical models and that actually integrate AI into medical vocational English education. That is exactly why I conducted this study. I wanted to build an AI-enhanced teaching model that tests whether it really works. So, what is the real problem with traditional medical English teaching? I see three major issues. First, there is a lack of authentic clinical scenarios. Students learn words like palpitation and symptom, but they really never actually use these words in a realistic doctor-patient conversation. The learning stays on paper. Second, there is no interactive evaluation. The teacher lectures, the students take notes. There is no real-time feedback. Students do not know whether they are pronouncing a word correctly or using the right phrase in a clinical situation. Third, the result is weak clinical communication competence. Students cannot transfer what they learn in the classroom to real clinical settings. And what are the consequences? Poor communication lead to patient safety risks, lower quality of care, and students who are not fully prepared for their future careers. As many researchers have emphasized, clinical communication competence is truly a core skill for patient safety. So what did I do? I set out to build and test an AI-enhanced integrated English teaching model specifically for medical vocational students. This model has three key innovations. First, it uses intelligent language tools like AI vocabulary and pronunciation systems. Second, it creates simulated clinical dialogues where students can practice realistic scenarios. And third, it includes AI-driven formative assessment that gives students real-time feedback. In short, my goal was to fill the empirical research gap in medical vocational English education, to move beyond theory and actually test whether AI can make a difference. Before going further, I briefly summarize what previous studies have found and what is still missing. According to this research, I found out that almost none of these studies focus specifically on medical vocational education, and very few actually tested on AI integrated model empirically. Most remain at the theoretical level. My study directly fills this gap by providing a practical, tested AI-enhanced model for medical vocational students. Now let me explain my research method. I use a quasi-experimental design over 12 weeks. I recruited 86 second-year clinical medicine students from a medical vocational college in Henan, China. I divided them into two groups, an experimental group who received AI-enhanced teaching and a control group who received traditional teaching. Before the experiment, I conducted a pre-test to make sure both groups started at the same level. The results confirmed no significant difference between the two groups, which means any improvement later could be attributed to the teaching method. So, what exactly does the AI teaching model look like? It has three core modules. The first one is intelligent language tools. This include AI-powered vocabulary learning, pronunciation correction, and a medical English corpus. Students can use these tools to build a solid language foundation. AI simulated clinical scenarios create realistic situations like patient admission interviews, diagnosis explanations, medical handovers, and discharge education. Students practice dialogues with virtual patient, and AI provides real-time prompts and corrections. The third module is AI-driven formative assessment, which can track each student's daily performance, generates personalized reports, and gives immediate feedback. Together, these three modules form a complete learning loop: teach, learn, evaluate, feedback, and improve. So as you can see, these are my findings after a few weeks, and I compare the post-test scores between the two groups. The results were very encouraging, and the difference is statistically highly significant. Apparently, the AI enhanced model worked. Students in the experimental group performed significantly better across all three measures. I also asked students in the experimental group about their experience. The response were overwhelmingly positive. More than 90% of students found the AI-enhanced model more interesting than traditional teaching. 86% said the simulated clinical scenarios helped them improve their practical communication skills, and nearly 90% said they would choose this teaching model again in future courses. So, not only did the model improve learning outcomes, students actually enjoyed it and wanted to continue use it. So let me take a moment to explain why this model is effective. There are three main reasons in my research. First, a real clinical immersion. AI scenarios bridge the gap between the classroom and the workplace. Students are no longer just memorizing words, they are actually using English in realistic clinical situation. Second, personalized learning. Intelligent tools adapt to each student's individual needs. A student who struggles with pronunciation gets actual pronunciation practice. Third, process-oriented evaluation. Instead of relying on a single final exam, the AI system provides continuous formative feedback throughout the learning process. So, what are the practical implication of this research? For educational institutions, I recommend investing in AI teaching tools and clinical simulation systems. These are no longer optional. They are becoming essential for quality medical education. For teachers, I suggest shifting from a lecturer-centered approach to a competency-oriented one, and using AI to provide differentiated instruction for different students. Besides, for assessment system, I recommend integrating AI-driven formative evaluation into a grading system rather than relying only on final exams. Of course, no study is perfect. Let me be honest about the limitations. The number of my sample, the innovation, and no long-term career follow-up, and so on. So for future research, I plan to expand to multi-region and multi-major studies, optimize AI scenarios for different medical fields like nursing and pharmacy, and conduct tracking of employment outcomes. So in conclusion, this research significantly improved three key outcomes: clinical communication confidence, English expression accuracy, and professional scenario application ability, and provides a replicable evidence-based pathway for transforming medical vocational English education in the AI era. It moves beyond theory and shows with real data that AI can make a meaningful difference in how we prepare medical students for their clinical careers. These are my reference lists been mentioned in this presentation. And thank you very much for your attention. I will be very happy to take any questions.